Hello everyone, today we're going to talk about fentanyl. This is a common pain medication that is given in the form of IV and also patches that you often see in the hospital. And so today I want to go over some different side effects and potential adverse reactions of this medication. Let's jump right into it. Number one, muscle rigidity. Now this is one that we don't often think about when we think of fentanyl, but it actually can cause rigid muscles, and specifically the muscles of the respiratory system. And an important thing to understand is if it is administered too fast, you can actually get some chest wall rigidity, so the patient may complain of chest tightness or chest pain. This is why it's important to administer slowly, typically over 3 to 5 minutes, and that often depends on the dose as well. Number two, sedation. This is one that often we don't want to just look for the patient to see if they're just not waking up, but we also want to look, are they having altered mental status? Are they speaking in a strange language or saying strange sentences? Are they saying things that don't make sense? Are they having issues with arousal? Number three, hypotension. If you have a patient that's already got low blood pressure, you want to be very cautious about giving any kind of narcotics because obviously they can decrease the blood pressure. And so specifically a patient who, let's say, is septic, which often goes with we'll see hypotension with that. We want to be very careful in these patients. Number four, respiratory depression. Now, this is one that we often know about IV pain medications in general, or just pain medications in general. Is that can cause respiratory depression, and that we really should have Narcan on backup. But some things that are important to look out for is not just their breathing, but also the color of their skin. If you see a bluish color to their skin, then that is something that may indicate that they're having difficulties breathing, they're not getting the circulation that they need, they're not getting the oxygen that they need. So it's just important to make sure to be watching not just the respirations, but also the color of their skin. Number five, balance issues. Now, these patients who are getting this medication, often dizziness is a potential side effect, and it can impair the gait. And so if you start noticing that a patient, specifically elderly patients, if you start noticing that they're kind of wobbling or that they kind of are swaying a little bit, this obviously can increase the risk for falls. And so it's important to watch for those different types of things, and it's often dose dependent. And so, a lot of times when you are giving the patient a lot of medication over time in higher doses, this can increase the risk for falls, in addition to all of these other things as well. All right, make sure to subscribe, and I hope you enjoyed this.